Fonda, if you.
Good afternoon, and welcome to today's 2021 Medicare Update presentation, the first in the series of Medicare educational sessions sponsored by the Milwaukee SHIP Collaborative. I am Michelle Allison, the Outreach Coordinator for the Milwaukee County Division on Aging. The Milwaukee SHIP Collaborative brings together federal, state, and local agencies to provide you with timely, accurate, and unbiased information about Medicare, Medicare cost assistance, Medicare Appeals, and Medicare Fraud prevention. This presentation is made possible by support from the United States Administration for Community Living through the State Health Insurance Assistance Program and the Medicare Improvements for Patients and Providers Act program, and the Wisconsin Department of Health Services through the Elder Benefit Specialist Program. During my presentation today, you will learn about the different parts of Medicare, how to enroll in Medicare, how to review your Medicare and prescription drug plan, financial assistance that may be available to assist with Medicare costs, Medicare coverage and appeals, and how to spot and report Medicare fraud. This is only a basic overview to help you better understand the Medicare process and to encourage you to review your plan during the open enrollment period. This presentation does not constitute legal advice, and each individual situation is different. No insurance companies sponsor this program, and the information provided is about Medicare generally without any preference for specific plans. The Milwaukee County Division on Aging assists Medicare eligible residents to enroll in Medicare plans and to resolve issues when using Medicare benefits. You can contact our Medicare benefit specialist by calling the Milwaukee County Aging Resource Center at 414-289-6874. Today's presentation will be recorded. During the presentation, please mute your phone by pressing *6 or by clicking on the microphone icon on the bottom of your screen. You will have the opportunity to ask questions at the end of the presentation or by typing questions into the chat box, assisted by clicking on the speech bubble icon on the bottom of your screen. That's accessed by clicking on the speech bubble icon on the bottom of your screen. Now I'm pleased to introduce today's presenters. Ginger Rogers, Medicare Part D Program Coordinator for Disability Rights, Wisconsin. Dan Itzikowski, SHIP Coordinator for Milwaukee County. Nina Yang, Elder Benefit Specialist for Milwaukee County. Jill Hegelson, Lead Medigap Helpline Counselor, Wisconsin Board of Aging and Long-Term Care. Matthew Hayes, Attorney and Director of the Senior Law Program at Legal Action of Wisconsin. And Ingrid Kundinger, Senior Medicare Patrol Project Manager at the Greater Wisconsin Agency on Aging Resources, GWAR. Ginger Rogers will start us off with a brief overview of Medicare and the Medicare enrollment process.
Ginger, you're muted.
Thank you. I'm so sorry. I'll start over. Thank you everyone for attending today. And thank you, Michelle, for the introduction. This will be a brief overview of Medicare and We will endeavor to help you understand some of the things you need to know in order to make decisions. Could I have the next slide, please? As Michelle said, this is brought to you by the State Health Insurance Program for free objective Medicare counseling. We are called the SHIP program. Next. When you become eligible for Medicare or you're nearing eligibility for Medicare, you need to make decisions. This presentation will help you to make important Medicare decisions like choosing the health and prescription drug coverage you may need, timing your decisions, which is very, very important because the timing ensures that you have coverage and you avoid penalties. So what is Medicare? Medicare is a health insurance program for people who are 65 years of age and older, those who are under the age of 65 that have certain disabilities, and any age for people with end-stage renal disease. It is administered by, thank you, the Centers for Medicare and Medicaid Services. It's called CMS. And enrollment is done through Social Security and through the Railroad Retirement Board only for those who are railroad retirees. This is a copy of the Medicare card that you will receive. Some people may remember the old Medicare card, which had your name, your Social Security number, when your Medicare began, Part A and Part B. If anyone has that card still, that card is outdated. The new cards have a number that is computer generated, which looks totally different from anything that you would have before. And if anyone still has the old card, they should toss it and call Social Security to get a new card. Next slide. So, when do you enroll in Medicare? Well, Medicare is not automatically done for most people. It is only automatic in certain situations for those who are at the age of 65 receiving Social Security retirement or disability benefits. It is not automatic for those who are 65 and still actively working or not receiving Social Security. If a person is actively working and or covered by insurance through their spouse's employer, they should check with their company's HR department, Human Resources Department, to determine how Medicare would work with that employer insurance. So, you found out, got to enroll in Medicare. I'm 65. So how do I do this? Well, when you are eligible to start Medicare and you are receiving Social Security benefits through either retirement or disability, you will receive approximately 3 months before you turn 65 an initial enrollment period package. This will be automatically mailed to you if you're receiving Social Security benefits. If you are not receiving those benefits, you will not get this package and you will not be notified that you need to enroll in Medicare. Your initial enrollment period when you are eligible to enroll in Medicare is a 7-month period. That period begins 3 months before the month in which you turn 65, includes the month that you turn 65, and ends 3 months after you turn 65. For example, you were born in April. Your initial enrollment period will start January 1st and will last 7 months later. It's January, February, March, the month you were born, April, then May, June, July, January 1st through July 31st. Now, if you miss that time frame, there are other times in which you may enroll. But if you delay enrollment, you may pay a penalty. That is when you need to call someone for assistance to make sure that you are doing this correctly. So here's your Medicare enrollment period. If you download this PowerPoint presentation, you will have this. This is what I explained before. So take a look at this. When you enroll, will drive when your coverage begins, especially Medicare Part B, which is the medical part of Medicare. So if you were born on the first day of the month, though, there's a little bit of a difference there. Your 7-month period begins and ends a month earlier than it would for anyone else. But if you have a question about that, you can either call for assistance or you can come to the Department on Aging or any helpline through the SHIP program, or you can call Social Security for that assistance. So Social Security, like I said before, is where you go to enroll in Medicare. But because of COVID, all the Social Security offices are closed and have remained closed. So in order to get the information you need, you would need to call the Social Security toll-free number 1-800-772-1213, or go online to socialsecurity.gov, ssa.gov, where you will find the online application to apply for Medicare. Also, you can call Medicare Request, the paper application, which you can mail back to Social Security. If you are retired from the railroad, this is another situation where you must call the local, for our region, Railroad Retirement Board office to get the information that you need in order to enroll. Their enrollment is different from everyone else. So again, the Social Security offices are closed, so you would need to call for information. As I mentioned before, there are other times that you can enroll in Medicare. Of course, during your 7-month initial enrollment period. And also there are other specific times when you miss your enrollment period, or you don't know if you missed your enrollment period, because some of these dates only pertain to certain situations. For example, the October 15th through December 7th is the Medicare open enrollment period. It is not for those who miss their enrollment period to necessarily enroll in Medicare, but for changing coverage. So you can't look at that date and think it's another time where if you missed enrollment into Medicare, that you can enroll in Medicare. No, that may not work for you. So if you miss your special enrollment period, either call one of the helplines to get assistance, or you can call Social Security for assistance with that too. Can I have the next slide, please? In order to enroll, again, I said you could go online. If you go to Social Security, you can go online there and enroll, or you can also go to the Medicare website to enroll. Now, you have to be very careful when you go to that you go to the right Medicare website. There are many of them out there, but the official Medicare website is Medicare.g as in government, O-B. It is Medicare.gov. like government. That is the official Medicare website that you go to enroll. Do not go to Medicare.com. That is another company altogether who has a look-alike Medicare website, and it is not the official government Medicare website. Next slide, please. When you go to Medicare and you enroll in Medicare, one of the things they may ask you to do is set up a Medicare account. A Medicare account allows you to access information on your Medicare claims, what your Medicare card looks like, and get other information regarding your Medicare. You go to medicare.gov, medicare.gov, and you put in this information and set up an account with a username and password. Then, in order to look at the different plans that are available for you and all other information by going to medicare.gov, you can look at what is called the Medicare Plan Finder. There are different parts of Medicare, A, B, C, and D. You need to know about these and you need to know what they offer. Many people, excuse me, already know about the Medicare Part D, which is the drug coverage, and they also know about Medicare Advantage plans. We see these commercials on TV quite a bit, but this is where you can go to the official Medicare.gov website and preview plans for 2022 if you are already enrolled in Medicare or you're going to be enrolling in Medicare in 2022, and see what is offered for your coverage needs. So now I will turn this over to Dan, who will talk to you more about the basics of Medicare. Thank you.
Great, thank you, Ginger. So before I launch in, we want to make sure that you understand three major points. First of all, Medicare is not free. There are costs associated with Medicare, no matter what kind of coverage you provide, you choose. And there is cost assistance available depending on your level of income. But in general, there are costs associated with Medicare, and we'll explain some of those costs as we move on in the presentation. Second, as Ginger noted, you must enroll in Medicare. Generally, except for those couple exceptions, the enrollment is not automatic and you'll need to affirmatively enroll in Medicare. And there are many choices of different types of plans, different styles of plans in the different parts of Medicare. So it is important to pay attention to that, and each year to review the coverage that you have to make sure that it still meets your needs and is affordable for you. And lastly, and this is again a point we will emphasize it near the end of the presentation, Medicare does not cover long-term care, i.e. the type of care you would associate with a long time stay in a nursing home. So it's not free, you must enroll, you have a lot of choices, and it doesn't cover nursing home long-term care stays. There are four parts to Medicare. Medicare is originated in 1965 as a government funded health insurance program for older adults. Original Medicare, as it's known, includes Part A and Part B, hospital insurance and medical insurance. And we'll detail each of those parts in a moment. The other two parts of Medicare were added later. Part C is otherwise known as Medicare Advantage plans. And these are private plans that must include all the coverages under Part A and Part B, but might include some other benefits as well. And Medicare Part D, which was the last part of Medicare to be added. And that covers, that's a voluntary enrollment part. So you don't have to enroll in a Part D Medicare prescription drug coverage plan, but they are available to you through Medicare. So Part A hospital, Part D healthcare provider insurance, Part C, the Medicare Advantage plans, and Part D for prescription drug coverage. Your two major choices, particularly when you are first enrolling in Medicare, are to decide whether you want to stay with original Medicare, the government-funded program, or to choose a Medicare Advantage plan. In original Medicare, you receive the standard government benefit, Part A hospital insurance and Part B medical insurance. As will be explained in a moment, there are some costs associated with both of these parts. And you can add Medicare supplemental insurance or a medigap policy, which is private insurance, which helps you pay for or cover the costs that you would incur when utilizing original Medicare under Part A and Part B. And we'll all have a presenter who will talk more about Medicare supplement. And you may add a Part D prescription drug plan. You must choose to add a prescription drug plan. It does not automatically come with original Medicare. So you can add Part D benefit as well. And we'll have a presentation on Part D itself later in this program. Next, Medicare Advantage plans. As I mentioned, these are private insurance companies who offer plans qualified by the Center for Medicare and Medicaid Service. And they include all of the coverage required under Part A and Part B. They may, and most do, include a prescription drug plan. And they may also offer some additional coverage that are not included in Part A or Part B. That is up to the individual plan. The major differences between the Medicare Advantage plan and original Medicare are that original Medicare, you can go to any doctor or hospital anywhere in the United States that takes Medicare, that accepts Medicare and is a Medicare provider. With a Medicare Advantage plan, generally they have a closed network. In other words, you will need to see a doctor or healthcare provider who is in the plan's network and service area for the lowest costs. They may cover doctors and healthcare providers outside that network, but that would probably be at a much higher cost. The plan, original Medicare, the costs that we'll explain to you are the costs that you'll get. They're standardized across the US. In Medicare Advantage plans, each private plan can develop its own cost structure. So it can choose to add a premium or a different co-pay for certain pieces or a different co-insurance ratio to help recoup the costs under that private plan. So it's really important to review all the different options that are available to you. With original Medicare, in terms of cost, for all Part B covered services, you're usually going to pay 20% of the Medicare approved amount after you meet your deductible. With Medicare Advantage plan, your out-of-pocket costs will vary, again, as I mentioned. There is no yearly limit on the costs under original Medicare, and that's why most people that choose original Medicare also choose a supplemental policy. With Medicare Advantage, there is a yearly limit on what you would pay out of pocket for services that Part A and Part B covers. You cannot buy a supplemental policy with Medicare Advantage plans. That's not how it's set up to work. And lastly, under both plans, they generally don't cover care outside of the United States, though in some instances, limited care might be covered by a supplemental plan under original Medicare, and some Medicare Advantage plans might have that type of coverage included, but the vast majority do not. Okay, so from here, I'm going to turn it on for a more detailed explanation of each part of Medicare, and we'll start off with Nina Yang from our Milwaukee County Elder Benefit Specialist. Nina?
Thank you, Dan. So I am going to talk about what Medicare Part A covers. So Medicare Part A covers inpatient hospital care, semi-private rooms that are not outpatient. You do have to be formally admitted to the hospital in order to have this cover under Part A. If you are staying overnight because a provider needs to observe you, unfortunately, that is not covered under Part A. That will be covered under Part B. Part A also covers skilled nursing facility rehabilitation, and you are required to have a 3-day stay in the hospital from being admitted. But because of COVID-19, that has been currently been waived until the end of the national health emergency. And home health services are covered if you need skilled care after being discharged from the hospital and you are going back home to get that care. And for hospice services, this is when an individual is diagnosed with a terminal illness and has less than 6 months to live. And usually, I would say maybe 100% of the services are covered under Part A for hospice services. And I'm going to discuss about the costs. So for being admitted at the hospital, there is a deductible that you have to meet, which is $1,484 for day 1 through 60. And you may meet this deductible within the first day or so. And then day 61 through 90, it'll cost you $371 a day for your stay. And after day 90, you have 60 lifetime reserve days. And those 60 lifetime reserve days, you can choose to use them. Once you do use them, they are non-renewable, and it will cost you $742 a day for utilizing your lifetime reserve days. And after that, you will be responsible to pay the full cost. As for nursing home care, for skilled nursing facility rehabilitation, the first 20 days is $0. After day 20, from day 21 to 100, it'll cost you $185.50 per day. And then after day 100, you're responsible for all costs. Next slide. So Medicare Part B covers medical services. So those medical services include physician services, outpatient hospital. Also, like I mentioned, anything with observation will be covered under Part B, emergency room, laboratory, medical, surgical services and supplies, any OT and PT, mental health services that are outpatient, durable medical equipment, preventative services, annual wellness visits, not physical. If you do request a physical, you will be responsible to pay the full cost of the physical. So just make sure that you are aware of that. Ambulance transportation to hospital or skilled nursing facility are covered under Part B. Due to COVID-19, coronavirus testing and vaccination are free of charge. If you are eligible to receive the COVID-19 booster shot, that is also free. And telehealth visits are covered and they may be free of charge. So paying for Part B services. So for this year, the Part B premium is $148.50. Depending on your income, you may have a higher Part B premium. And also with original Medicare, there is a yearly deductible of $203 for 2021. Just to note that the yearly deductible and the Part B premium, they do change every year. So they will increase. And as well too with Part B, original Medicare only covers 80% and you'll be responsible to pay the 20% of their services. And there are assistants that you may be eligible to help pay for any of the premiums of Part B, maybe Part A, deductibles and co-payments through the Medicare Savings Program, which we would discuss later on in the presentation. So decisions of whether or not you should keep or sign up for Part B. So it all depends. So you should consider keeping it if you are already enrolled due to disability. Like I mentioned, everybody has a premium that they have to pay for Part B unless you may be eligible for the Medicare Savings Program. And the premiums are deducted from your Social Security Administration check or from the railroad benefits. And it all depends on your income to determine what that premium is. Also, if you or your spouse have employer coverage, you'll want to contact your HR to determine how Medicare works, to determine whether or not you should keep Part B or wait to enroll. And also determine whether or not you or your spouse have government or military coverage as well too. Next slide. So you must have Part B if you want to join a medigap policy, as well with the Medicare Advantage plan. So for both of these, you have to have Part A and B in order to join or purchase a medigap or a Medicare Advantage plan. Also for TRICARE, you'll want to enroll in Part B as well too. And if your employer requires that you must enroll in Part B, talk to your employer's benefit administrator. As for veteran benefits, it is optional if you do choose to enroll in Part B. However, if you choose not to enroll during your initial enrollment period, you may be penalized for not enrolling when you should have. So just make sure that you do weigh out your options. So what is not covered by Part A and Part B? So routine physicals are not covered, so make sure you do ask for a wellness check. Most dental care and dentures, hearing aids and fitting exams, routine eye exams for prescription glasses, most cosmetic surgery, massage therapy, acupunctures, and long-term care are not covered. So now I'm going to turn this over to Jill, who will explain more about the medigap.
Hi, I'm Jill with the Medigap Helpline, and we serve the state of Wisconsin in counseling and exactly this, Medigap Advantage plans and knowing what the difference is and what to do. If you want to get a hold of us, we are part of the Wisconsin SHIP and the phone number's on the back of the Medicare and U book. So what is a Medigap policy? You heard Nina talk about all the costs of Medicare and how much it's going to be. So Medigap policy can be purchased. It is sold by private insurance companies. It is not part of Medicare, and it works with original Medicare. It fills in the gaps of Medicare. So that Part A deductible, that $14.84, you can have that covered through your Medigap policy. The Part B deductible, if you became eligible for Medicare prior to 1/1/20, then you could have the rider that would cover that cost. It also provides coverage for outside the US. It's limited coverage. If you're going to travel, make sure that you know what your policy will cover. In Wisconsin, it's set up a little bit differently than most states. The Medicare supplement policies, there's a basic benefit, so it doesn't matter who you get the policy from, that basic benefit is the same. It does include additional coverage for chiropractic. It has a 30-day skilled care mandate, which does not require that free overnight stay in the hospital. And there's some other coverage in that. Next slide. Do I need a Medigap policy? I think maybe. I think it's important to sit down with a counselor before you talk with an insurance person and understand what the difference is so you know what your shopping list should be. Things to consider. Medigap only works with original Medicare. Do you have other supplemental coverage? Are you a veteran? Do you have an employer plan, a retiree plan? If you have other insurance, it might work as good or better than a Medigap policy, and you wouldn't need to spend that extra money. Can you afford the Medicare deductibles and copays? How much is your out-of-pocket going to be? What's the monthly premium for Medigap? Can you afford that? What other coverage could you use? You know, and understand that Medigap policies, Medicare supplement policies will only work with original Medicare. Next slide. The best time to buy a Medigap policy. So you have an open enrollment period when you first start Medicare, and it starts the month of Medicare and it goes for 6 months. Hold on one second, sorry. If you're 65 and older and disabled and enrolled in Medicare Part B, so the best time to buy is that 6-month period. You have protections where the plan must sell you a policy without pre-existing conditions. If you remember a few years back, we had a law that said pre-existing conditions cannot be taken into account for insurance. That's primary policies. So that would be your Medicare, your Advantage plans. Those are primary policies. Secondary policies would be the Medigap policy. So if you don't purchase it when it's originally offered, when you first start Medicare, there may be other times when you could purchase it, but there may be restrictions. There's no guarantee if you don't buy it during your open enrollment that a plan will take you. You may have to answer health questions. If they do accept you, there might be an increase in costs, and the coverage may change a little bit. So just know that if you're starting Medicare, this is an option that you should look at and understand before making your decision. Next slide. How do you find the right Medigap policy for me? I would say call the Medigap helpline. There's our phone number. Talk with a counselor to find out and understand what a Medigap policy is. There is a plan finder tool at medicare.gov. I don't think that it doesn't give prices, it gives names. You could also go to the Insurance Commissioner's Office, oci.gov in Wisconsin, and they have a list. That list is updated every year of policies sold in Wisconsin. The Medigap helpline also has that document if you need it. Next slide. Oh, call an insurance company, talk to an insurance agent. When I'm talking to somebody about purchasing a supplement, they've decided this is the way they want to go. Shop around. You have a relationship with somebody who sells insurance, your homeowner's insurance, car insurance, whatever. Call them and find out, do they sell a Medigap policy? And what are the prices? Know what the basic benefit is, but know what riders you want to purchase. There are 7 different riders. Some are benefit riders, and some of them are like takeaway riders, where you assume more of the financial responsibility with that policy. So understand those. Now we're going to talk about Medicare Advantage plans. These are so totally different when we're talking about Medicare supplements and Advantage plans. At the turn of the century, we started with Medicare Advantage plans because people wanted to have choices. So in 2000, when these first started, the Medicare C was a choice. You choose a private health insurance company to become your Medicare. You make a contract with that company. In most instances, you have to have both Medicare A and B, and that company then provides you with your Medicare coverage. It's another way to have Medicare. How does this work? Well, you still have Medicare and all the rights and protections. It includes all your Part A and Part B covered services. Again, you must be enrolled in Part A and B in order to join or to get a Medicare Advantage plan. It may include prescription drug coverage. If the plan offers drug coverage, then you must take that package. Unless you have other creditable drug coverage, they'll talk about that shortly. You would not need to have that drug coverage. It may include extra benefits. So here, I know Ingrid's going to talk about this, but when you're watching the television and you see those commercials, those are nationwide commercials. Some of those benefits are offered in Wisconsin and some of them are not. So if you're looking at Advantage plans, understand what you're buying. Also understand that the provider has a network, so you may be limited on where you can see doctors. Make sure your doctors are part of the network before joining. It may have additional premiums depending on the plan, and this is a way to cap Medicare. So there is a maximum out of pocket. So if you belong to XYZ PPO, when you use so much money, then you, let's say the maximum out of pocket could be $5,000. When you've paid $5,000 for the year, then the PPO is responsible for the rest of the covered costs that go with that Advantage plan. And I'm going to turn it over. I believe, Ginger, you're going to do the Part D. Thank you.
Yes, I am. Thank you very much, Jill. Okay, we're going to go through this quickly because time is flying past. So we're going to talk a little bit about Medicare Part D, which is a prescription drug coverage under Medicare. It is available for everyone who is enrolled in Medicare, either Part A or Part B. You do not have to have both to enroll in a Medicare prescription drug plan. And it is provided through private insurance companies who sponsor the Medicare Advantage plans, as Joe was talking about, and also Medicare prescription drug plans. How does this work? It is an optional benefit. As was said earlier, you do not have to join a Medicare prescription drug plan. But if you don't, there could be a problem. You could be facing penalties. The plans, though, have formularies. If you remember with your insurance through your job or through your spouse's employer, and you have prescription drug coverage, they told you what medications they would cover. It's called a list of covered drugs or formulary. Same thing under Medicare Part D. Under Medicare Part D, the plans are in regions. Some plans may have plans throughout the whole United States, but they are regional. So there are plans in Wisconsin and there are plans in Illinois. You have to join the ones in Wisconsin. You pay a monthly premium. All Medicare Part D plans have a premium. You also have to pay a deductible, and that deductible can range in 2021 between $0 up to $480. So you do have to pay a deductible. You have coinsurance and copayments amount for your medications. Now, this is all can become expensive. So there is extra help out there to help people who have a limited income and resources to help pay for their Medicare Part D costs. What is covered under Part D? Prescription medications. These prescription medications must be approved by the FDA for medically indicated conditions. Certain vaccines are covered, such as shingles, not the flu shot. The flu shot is covered under Part B, as in boy. It also covers insulin and the supplies needed to inject insulin, such as syringes and needles. No over-the-counter medications are covered under Part D. So no cough medicine, no vitamins, no minerals, nothing like that are covered under Part D. So should you enroll in a Part D plan? It depends. You should take into consideration, do you have creditable drug coverage? Every year, if you are covered under a prescription drug plan, For example, through an employer, they must send out information that says, yes, our prescription drug coverage is as good as Medicare or it is not. Will that coverage end when you retire? Yes or no? If it does, do you need to enroll in a Part D plan? How much do your current drugs cost? And what are the premium? The cost is a driver for a lot of this. These are many of the things you need to take into consideration on top of what your medications are to decide whether or not you should enroll in a Part D plan. Next slide, please. Dan, next slide. Thank you. So how do you choose a Medicare Advantage Part D plan? You can call the Milwaukee SHIP Collaborative for help comparing plans. This is what we do. We look at this information and help you make a decision. You can call the Aging Resource Center or you can call the Medicare Part D helpline, and we will be able to talk to you specifically about Wisconsin and what we are able to help you with and help you make that decision. You can also call 1-800-Medicare. They have counselors there also who will be able to assist you in making a decision. And you can also go on your own and you can look at the Medicare Plan Finder at medicare.gov. Now, in Wisconsin, we have a special prescription assistance program called Senior Care. This is a program that started about 15 years ago or more. And Senior Care is a prescription drug for assistance for Wisconsin seniors. You must be 65 and older to enroll in this program. It covers many prescription medications at a lower cost, and it has levels of coverage. The good thing about the Senior Care program is it's considered as good as Medicare Part B. So if you are interested in looking at this and seeing if this would be something that you could take into consideration instead of Medicare Part D, because if you remember I said creditable coverage. Senior Care is considered creditable coverage. And so this may be an alternative to enrolling in a Medicare Part D plan. Next slide. Now I will turn it over to Matthew Hayes, and he's going to talk to you about Medicare Appeals and patient information and rights. Thank you.
Hello, I'm Matthew Hayes with Legal Action of Wisconsin, and we provide free legal services as well as benefit counseling to residents of Milwaukee County. I'm going to talk about Medicare Appeals and then go over quickly assistance for low income Medicare beneficiaries. So first with Medicare Appeals, there's a lot of reasons why a service that a person receives or an item such as durable medical equipment would be denied by the Medicare program. For example, if the item is simply not on a list of covered services by Medicare, it could be denied. But also very commonly, an item or service would be denied because it's not medically necessary for the individual who receives it. And medical necessity is something that your provider is supposed to provide information to Medicare in order for the claim that is sent in to be covered. If you receive a denial of a service or item through the Medicare program, Generally, the way you know that is from what's called the Medicare summary notice, or if you're on Medicare Advantage, it might be an explanation of benefits. The Medicare summary notice explains why something is not covered, if it's not covered, and how much you owe. It also explains how you can appeal that decision. And so the information about where to send your appeal and how to do that is all on the Medicare summary notice. There's several levels of appeal, and legal action provides assistance and representation for Medicare appeals if it gets to that point. But for the first level of appeal, it's very easy to send in the appeal by simply sending in the summary notice itself with an indication that you disagree with what's happening. As far as other types of appeals where you wouldn't get a Medicare summary notice, if you're in a hospital or a nursing home, the appeal process is a little different. You will be informed that Medicare will no longer cover your services, at which point you can simply make a phone call to what's called a beneficiary and family-centered care quality improvement organization in order to appeal the decision of the nursing home or hospital. So that information is listed there. And then the information for contacting senior law, which is part of Legal Action of Wisconsin, is listed at the bottom in case you need help with an appeal. Next slide, please. Next up, talking about programs available for people with limited incomes who are on Medicare. We're going to talk about Medicaid, the Medicare savings programs, and extra help available through the Social Security Administration. Medicaid is a program that's available to individuals with limited income as well as limited resources, also known as assets. You can have both Medicare and Medicaid. You apply for Medicaid through the access.gov website or by calling Milwaukee Enrollment Services. And essentially, the Medicare savings programs are a type of Medicaid that is specifically available to people on Medicare. And these programs, if you're eligible, if you meet the income and asset resource limits, they will pay your premiums that you would normally pay under Medicare. Depending on your income, it might also pay your deductibles and coinsurance, and you will automatically get assistance with all of your prescription costs if you're eligible for the Medicare savings programs. You apply through these through the Milwaukee Enrollment Services or through access.com. It's a state administered benefit, and so you apply for it as you would other types of Medicaid. And then finally, or second to finally, there's the extra help program. If you're not eligible for the Medicare savings programs, which would provide assistance with your prescription drugs, you can apply directly with the Social Security Administration for extra help with prescriptions. The income limits are a little bit higher, so it's more likely that more people could be eligible for just extra help if they're not eligible for the Medicare savings programs. And they will make your prescription drugs lower cost, lower premiums or no premiums, and very low costs for at the pharmacy that people would have to pay if they're eligible for that. And then the final slide here just refers to the prescription advocacy and referral service available through the Social Development Commission. If you're not eligible for Medicare Part D, then the Social Development Commission can help people sign up for programs available through prescription or pharmaceutical companies that will lower the costs of prescriptions if you don't have, generally don't have other insurance in most cases. So that's a free service available from the Social Development Commission. And that's all I have.
All right, we're almost there. So thank you so much for sticking with us. My name is Ingrid Kundinger. I am here from the Wisconsin Senior Medicare Patrol and have the opportunity, maybe that's not the right word, but I get to talk to you a little bit about Medicare fraud. So we've learned a lot about Medicare, about all the different options, all the decisions that you need to keep in mind as you're enrolling in Medicare for the first time or re-examining things every year beyond that. I'm here to tell you that unfortunately, there's also a lot of Medicare fraud that happens across the country. So much so that there's a national program, the Senior Medicare Patrol, dedicated to, as the slide here says, help people protect themselves from Medicare fraud, detect if it has happened to them, and then to report. So when we talk about protecting really quickly, important for you to just remember not to share personal information over the phone with people who are calling you out of the blue, asking you random questions about your health, or perhaps some medical equipment that you may or may not need. Just a best practice to keep that information private for yourself. It will save you a lot of hassle in the long run. As far as detection, we encourage people to really become familiar with the statements that they receive. If you choose Original Medicare, you would receive a Medicare summary notice from Medicare on a quarterly basis that would list all of the claims that are filed with your Medicare information during that 3-month period. Very important to just take a few minutes every time that comes in the mail, or if you have an account with Medicare.gov, you would be able to see that information electronically. But either way you receive that, it's really important to take a few minutes to review that to make sure that it's an accurate reflection of your health care. If you choose to have a Medicare Advantage plan, you would receive an explanation of benefits statement from your insurance company. Again, really important to check those statements to make sure that everything's accurate. And if there are discrepancies, that's the opportunity for you to be your own best advocate, to call your provider. If you're not getting assistance that way, you can certainly call the Senior Medicare Patrol. We can help kind of work through that with you. So that leads me to reporting. We operate a toll-free helpline here in the state of Wisconsin that you can call at any time to talk with me about any concerns. If you received a suspicious phone call, if maybe you shared personal information over the phone and now you're wondering what you can do about that, all of those different things we can help you with. Next slide, please. Just want to give you a couple of ideas of what we're talking about when we're talking about Medicare scams. So here's what we're seeing in Wisconsin, or here are the kind of the top 4 issues that cause our helpline to ring on a regular basis. The first one being cardiac genetic testing scams. These are happening primarily over the phone, and a company or an individual is calling and saying, hey, do you have heart history or heart issues in your family? Are you interested in learning more about your cardiac health that you can share with your family? They're going to send you a test kit, et cetera, et cetera. The catch here similarly is that they want your Medicare information. And they want your Medicare information because they are going to do whatever they can to submit a claim to Medicare to be reimbursed for something that wasn't ordered by your doctor, that perhaps wasn't wanted or needed by you. And so they're just out to get personal information from folks. So cardiac genetic testing is a newer scam that we've been hearing about here in Wisconsin as well as across the country. So something for you to be aware of as you're answering your telephone. The second thing, durable medical equipment scams. These are the back braces, the neck braces, any sort of body part that could have a brace, kind of a scam. Again, oftentimes people are contacted over the phone. Sometimes these folks are quite aggressive with people demanding Medicare information in exchange for a back brace or some sort of a brace. Again, best practice, if you do answer the phone and it's someone who you've never heard from before, talking about something that you would prefer to talk to your own healthcare provider with, just hang up the phone. That'll avoid all sorts of problems. And as it relates to all of the things that pertaining to your health, we encourage people, if you think maybe you would benefit from a back brace, call your healthcare provider directly and talk with them, him or her, about your concerns, and they'll help you get connected with a company local that will be able to help you with that requirement. The next thing we hear a lot about, new Medicare card scams. Ginger showed a slide earlier that showed you what that Medicare card looks like. It's your red, white, and blue card. It's printed on kind of postcard-like paper, nothing fancy, The scams that we hear about are that people need to get a plastic card. There aren't plastic Medicare cards, so that's not a thing, kind of like a credit card. We've also been hearing that people are getting calls that their red, white, and blue cards are going to be expiring, and that the new cards are another combination of colors, black, red, white, and yellow, or any other combination. We've also heard, because of the COVID-19 pandemic, that there are scams out there related to new Medicare cards that are black and white for the COVID-19 pandemic. Again, no new Medicare cards, just your plain old red, white, and blue paper card. That's the card that comes from Medicare directly. So if someone calls you about a new Medicare card, hang up the phone and then you can check that off your list. And then lastly, people will call us with billing questions or concerns. So that means that they're looking at their statements, they have questions. That gives us an opportunity to talk through those concerns, reach out to providers to get more information. And if we suspect that there are suspicious billing practices taking place, we will take the next steps to report those. Next slide, please. And then lastly, we are entering officially tomorrow is the annual open enrollment period for Medicare, which is the time between October 15th and December 7th every year, where people can choose to make changes to their Medicare Advantage plans, their Part D plans. Again, so that means that there's a lot of extra information out there that can be extremely confusing. So we just want to make sure that people are aware that yes, you do have the opportunity to make changes, but just to do that with caution and to really do your homework to make sure that you are choosing a plan that is truly going to be in your best interest. You're going to see a lot of additional phone calls. You're going to get mailers in the mail. There's a lot of different things coming from a lot of different insurance companies. Just be cautious as you're looking through all of that. As Jill mentioned, there's a lot of celebrity TV commercials right now about Medicare plans. They're trying to make you feel like you're missing out on something or that the time is really running out for you to enroll. Just remember that, again, those are most often nationwide plans, and in some situations, those things would not be available in Wisconsin. So while it does seem too good to be true, oftentimes it is, and we would encourage you to reach out to local resources to get some more information about that. Also, a lot of times insurance agents or brokers will be misrepresenting their role, their identity, or both, or sharing facts that are maybe not quite exactly how they should be presented relating to different Medicare Advantage plans. So again, just really important to be cautious. You can certainly attend events that are being held by insurance agents or brokers, but just remember that you don't have to sign on the dotted line at that event. Take time, gather information, reach out to the resources that we've talked about during this presentation to get some more information to go through that. So again, we want to make sure that you end up with the most appropriate plan for you. And then lastly, use of scare tactics, sense of urgency. Take your time. While I say that, you also do need to make decisions related to changes by December 7th, but you can certainly take up until that time to do your homework and make sure that you have the best information for you. At this point, I will turn it back to Michelle to wrap up our presentation today. Thank you.
Hello, and thank you for attending our presentation. Some key points to remember is that Medicare is a health insurance program and it is not free. There are many ways to get coverage within the program. There are programs for people with limited income and resources to help pay for premiums and services, and that SHIP or Medicare counselors provide free and objective assistance to navigate Medicare. For the decisions, it is important to make the right decisions and make them at the right time, and get help if you need it. For more information on Medicare resources, feel free to contact the Milwaukee County Aging Resource Center. We are local here in Milwaukee County. The number is 414-289-6874. You can also contact Senior Law Elder Benefit Specialists Their number is 414-278-1222. You can contact the Disabilities Right Wisconsin Medicare Part D helpline. Their number is 800-926-4862. And then for federal resources, you can contact the Center for Medicare and Medicaid Services or dial 1-800-MEDICARE. That's 1-800-MEDICARE. This presentation was presented in collaboration with Disability Rights Wisconsin, Legal Action of Wisconsin, the State of Wisconsin Board on Aging and Long-Term Care, and the Milwaukee County Division on Aging.
So that's it for today's presentation, everybody. We thank you again for joining us and for being patient during this presentation today. We hope that we provided you with valuable information to help you make decisions, whether you're enrolling in Medicare for the first time or whether you're reviewing your plan and plan choices during the upcoming enrollment period from tomorrow, October 15th through December 7th of 2021 for your Medicare 2022 plans. At this time, we will just take a look here to see if we have any questions that have been posted in chat, and I do not see any questions. If you do have a question at this time, you may unmute yourself by pressing the microphone icon on the bottom of your screen or pressing *6 on your phone, and we will attempt to give you an answer. Okay, it does not appear like we have any specific questions for our presenters today. So again, thank you for joining us. This presentation has been recorded and it will be posted on our website of the Milwaukee County Division on Aging's Medicare 101 webpage. So if you go to the county.milwaukee.gov webpage, search for the Division on Aging or Medicare 101, you will find that page, and a copy of this recording will be there for you, as well as copies of the slides that were presented today. And we encourage you to revisit the other information that is available on that site. And again, to reach out for help from any of the providers that offered assistance today. We all are funded through the government to provide free help to you. Thank you very much and enjoy the rest of your afternoon.